Hey, I'm Michelle with Balanced Health, and in today be a little bit longer video than normal, but I just want to talk a little bit about the common fact conception that doing hormone replacement therapy increases the risk of breast cancer. So many years ago, it was standard, women as they approached menopause, they were put on hormone replacement, and they continued that sometimes until they died. And then there was a very large study done, which is good. Women are often underrepresented in studies. We're usually eliminated because of our hormones. And so there was a very large study done specific to women and hormone replacement therapy. So as the study was going on, they noticed an increased risk of breast cancer. So the media reviewed that information and started putting it out, because negative information gets people watching. So they put it out before any of the doctors and research analysts had reviewed that information and could put it kind of in context. So it just went everywhere. So women were calling the doctors saying, I want to get off this stuff. I'm not taking it anymore, yada, yada. To where it transitioned to now, a lot of women, I would say the majority of women, are scared of hormone replacement therapy. So as I've been, myself included, as I was transitioning through menopause, I was against taking it because my grandmother had breast cancer, and I didn't want to increase my risk. It got to a point where I just could not sleep. That was my biggest issue, night sweats and not sleeping. And I was like, it's not healthy for me to not sleep. I don't know how long this is going to take. I can't not sleep for years, right? So I went to my midwife and talked with her, and she said, yes, it is an increased risk. It's slight, blah, blah, blah. So I decided I would do it for a short term. I did. It helped immediately, and then I transitioned back off. I was on it a very short time. Now, as I'm studying this and learning more about this study, it's really been a disservice to women, because let me explain a little bit about this study. So the number of women without any hormones in this study, because you want to compare apples to apples. So the women without any hormones, the risk of breast cancer in that group was 4 in 1,000. The group of women on hormone replacement therapy was 5 in 1,000. So depending on how you do your math, you could say, well, that's a 20% increase. And it is, but also you got to look at the bigger picture. We went from 4 to 5. So in the scheme of things, that's not a huge increase. Is an increase for sure, but it's not huge. And then of that one, when you really look at the study, the increased risk to go from the 4 to the 5, is the length of time essentially that women go without estrogen. So if the women are over 60, most menopause is around 50-ish years old. So over 60, because it's been 10 years without estrogen in their body essentially, or if it's been more than 10 years since that time, so 60 or 10 years, it's the 10 years that makes the difference. And then you put estrogen back in that system, that is an uptick in the risk. So if you're in that particular category, you'd really want to consider that. The rest of us, though, it is a very minimal increased risk. On the other hand, what women have not been told is that estrogen affects all of our body systems, and it's protective. So probably you may know, most women know that the number one killer of women is cardiovascular disease. So before menopause, we have a much lower risk, but after menopause, ours is the same as men. Well, what happens after menopause? We don't have the estrogen. So it's protective. So that's just one system per se. It's protective for our brains. It helps decrease risk of dementia and Alzheimer's, just all kinds of things. So it's very protective. So women have been done a disservice because we're told, you don't need it because it increases your risk. Instead of women getting the whole picture and looking at their health in particular and deciding what's best for me based on my risk. So for me personally, I shared my story at the beginning. My grandmother did have breast cancer and she died from breast cancer. So for me, I've had the gene test. I don't have BRCA or 1 or 2, I mean. And so I'm not really, because it's a grandmother, that doesn't increase my risk. If it's a mom, a sister, or an aunt, then that does increase your risk more, but a grandmother doesn't. So for me, in my case, because of the benefits, I decided that for me it was the decision I wanted to protect my health and start hormone replacement therapy. So I hope that clears it up a little bit. Hopefully you have some questions and you can just ask them below.